Hi, this is Sierra. I'm here with All Things Aesthetics, and I am beyond thrilled to introduce Linda Burhance, Chief Product Officer for Marena. Marena is a post-surgical garment company that supports patients in reducing inflammation and just their overall healing journey. So, Linda, I'll have you introduce yourself, and then we'll dive into how you got into this prestigious role.
Thank you, Sierra. I'm really thrilled to be here and to be sharing our knowledge with the patient community about the healing process. And at Marena, I came to Marena as a consultant almost 8 years ago. They acquired me, as my son likes to say, as Chief Product Officer, and I came through it in kind of an interesting way. I was always in apparel, compression theory, intimates, garment making. I have a degree in pattern making, fashion design. And then I started my own company and I started working with a lot of doctors and realized that they needed help with kind of what they were doing with their patients, and that by happenstance met someone at Marena that needed someone to kind of come in and work with doctors and develop products, and this is where I am now, almost 8 years later.
Wonderful, I love it. So just to give patients some insight, because it may be their first time just even diving into plastic surgery and figuring out, oh my gosh, what comes next? Right. So what are compression garments and what is their importance following surgery?
That's such a great question. Not a lot of people know that the compression that you wear, the garments that you wear after surgery, are very vital and important, and they play an important role in your healing journey. One of the things they help to do, first and foremost, is to protect the skin and to support the skin. So if you have an incision, if you have entry points into the body, you want to make sure that that's supported so that there's no tension or pressure on that. But the next important thing is the compression part. The compression helps to send fluid back through the lymphatic drainage system so that you're getting those fluids out as quickly as possible. And fluid is a natural response that the body has after a surgical event. It's nothing that's you have to be concerned about. You just have to make sure that you're following your doctor's instructions. And we know that 98% of plastic surgeons recommend compression. Over 70% recommend compression in all surgeries, and then the rest are in some surgeries. But we really believe for your healing journey, it's best to wear compression, and Marena compression,
yes.
Of course.
Specifically.
Specifically.
I know when we were preparing, you mentioned, if you stub a toe or something like that, the first thing you want to do is apply pressure. And so the compression garments support in applying pressure to help with the healing journey. So that was a great tip that really simplified everything that, I wanted to make sure you repeated.
It's true, yes. It helps with pain management.
Yes.
You might feel a sense of a little bit of pain, and so again, as you said, if you hit your finger on the table or something, you grab it and squeeze it. That is a natural response, and so compressions shouldn't feel constrictive. At Marena, we do a lot of third-party testing to make sure that our compression is really like a gentle hug.
Yes.
We want to make sure that you're keeping your garment on. A lot of our patients will say they feel better in a Marena garment than out of the garment, and that's because it's doing its job. You wouldn't want your compression to be constrictive.
Right.
You want to keep it on your body so it should be comfortable.
For sure, for sure. And that kind of leads directly into our next topic. So Marena garments versus standard. I know some people are like, oh, I can find them on Amazon or, just on any array of different websites. So what really sets Marena garments apart from just any other garment that you could find on the internet?
That's a great question. We are a medical device.
Yes.
We are FDA registered. We put a lot of time and effort into our certification process to ensure that we are complying with all of the standards. We have multiple certifications, including making sure that our fabric is biocompatible. We want to make sure there are no known hazards in our fabrics and findings, and that all is surrounding the fact that we're helping a healing patient. And when there are entry points in the body, you want to make sure nothing gets into the bloodstream. Also, our compression theory is really specific. It is specific to the healing patient, whether it's aesthetic surgery or unfortunately, a non-elective surgery like mastectomy, where there's something that is happening and it's a surgical trauma, we want to make sure that everything that's touching the body is something that's going to help and not have any adverse effects. We have active silver ion agents to help with antibacterial properties, and our fabric is tested at third-party labs in terms of its stretch and its rebounding effect, and the rebounding effect is where you get the compression. So we want to make sure that you are extremely comfortable. We want you to keep that garment on as long as your clinician tells you to. And so, just buying something typical off of, just a random website may not have, the science and technology.
Yes.
And then some of the allergens too. You want to really make sure you are choosing your garment the way you would choose your doctor with great care.
Yeah, for sure. And I know that kind of a buzzword around just fashion in a whole is forever chemicals. So can you talk to me about how you guys avoid forever chemicals, especially with open incisions and wounds?
Yes.
Would love to just learn more about how you guys are making sure that you have the best quality fabric.
Right, so every year, because we are ISO 13485, which sounds like a lot of gobbledygook, but it is a medical designation under our quality management system.
Yes.
We have to get third parties to test for these types of chemicals. We rely on our fabric manufacturers to provide us with a third-party certificate, and it has to be from an accredited source. So, some people can say, wow, you can get those certificates anywhere. Yes, you can. Ours are accredited labs that have significant accreditation worldwide. We also sell in over 54 countries, so we make sure we comply within the standard of each country as well. And we have a certification saying there are no known forever chemicals in any of our manufacturing processes.
Wonderful. And I know you have the ability to track each and every garment all the way through from start to finish. So can you talk to me a little bit about that process and how it gives patients added just comfort and peace of mind?
Yes, so that's another thing. Because we are a medical device and we operate under a quality management system, we have a whole quality and regulatory department. It's a completely separate department than product development or manufacturing, and they follow strict rules and strict guidelines, making sure that we are, getting the certifications we need. We apply a code or a lot number to each and every batch of products, and then we can trace back. In the very rare event that something happens, we can trace it back. We will make sure, that we solve through a corrective action, which is super important in our quality management system. And we are audited every year through the quality management system by a third-party auditor to say, here are the corrective actions we took, if any. Yes. And here's what we did, and did the steps follow those guidelines?
Of course, wonderful. And I know, just in terms of compression, as the patient is going through the healing journey, there's different steps of compression. So as we're tracking these garments and, just knowing them from start to finish, we're also guiding the patient through their journey. So as you guide them through their journey, I know that Marena has different steps.
Yes.
So could you talk to us about the different steps and what those entail just in terms of compression and how it supports, healing as a whole with each step?
Absolutely. So we have a compression theory that's based on a clinical study that was founded by Dr. Yves Girard-Allouze, who was considered the grandfather of modern-day liposuction, a French surgeon. And it says basically in his clinical study that it should be a certain range of compression. So all of our garments fall within that range, and we have testing equipment that we do when we're developing and designing the garments to make sure they're falling in that range. In terms of the step 1 and step 2 garments, the step 1 garments are really designed for the clinician to easily get it on the body. A lot of our patients wake up in the garment. They may not realize that they're gonna wake up post-surgically in the garment. So it helps the clinician get the garment on. It has several entry points that open flat. And then also for a healing patient, if your mobility is slightly impacted, you have easy access at different points in order to make it tighter. As your swelling starts to go down, you want to just gently make sure you're still, getting that gentle hug. And then at some point, you're going to be out of that type of garment. You're going to go back to your everyday life. Want to continue to wear compression just to make sure that skin is retracting, those scars are staying nice and flat. And so you want something that's a little bit less, medical looking, and has, just more of a pull-on feature. So it looks a little bit more seamless under your clothing, and that's when you get back into your everyday life. So we have those steps. Now, we also get asked all of the time, because our compression is so comfortable, what about when I'm allowed to go back to the gym or I'm going back to work? And we make a shapewear and a athletic wear line as well, because people love the feel of our compression.
Yes, and I love that you guys have the wear one, wash one promotion.
Yes.
So could you talk patients through what that looks like and just what the overall purpose of that program is?
So some doctors are going to recommend that you wear your garment 24/7.
Yes.
So, and sometimes they even ask you to shower in it, and ours has a fast drying mechanism to it. So we recommend, really, if you're only going to be removing the garment for 15 minutes a day, buy two. Have one that you're wearing and one that you're washing. And that just helps you in not having to think about, whether or not you have a fresh garment for you. And in any event, the active silver ions will help with, the antibacterial, any odors or anything that's going to be happening. That's fine, it'll take care of that. But we do recommend a wear one, wash one strategy.
Wonderful. And I know you talked about the skin retracting. So could you talk about how the pressure sensor technology supports in ensuring the skin is retracting and, again, the fluid is being pushed to those lymph nodes?
Yes, absolutely. So this is our sweet spot in product development. We really spend a lot of time and effort on this.
Yes.
We have our own testing equipment. We follow these guidelines with this particular range from Dr. Eloise. And it's really important that you're getting this range, because if it's too much compression, could actually inhibit the oxygen getting to the outermost layer of the skin. So you want to make sure that the skin stays really healthy. And not enough compression, that fluid is going to build up, and that's both painful and can lead to infection. So you want to make sure you're staying in this range, it's a medical grade garment, and you're getting that skin to be supported. So if they're taking away some fat, your skin is going to be a little bit lax and loose. So you want to make sure that, we're anti-gravity devices. We're making sure that gravity's not pushing that skin down and making some sort of a, uncomfortable looking, unattractive looking area. So we want to make sure it retracts. There is a theory called Laplace's theory of skin retraction, and your body will naturally retract. We're just giving it a gentle little extra hug to make sure it's really happening.
Wonderful, wonderful. And I know a lot of patients are concerned about scarring after surgery. And I know that the garments do support with that as well. Obviously, if there's an incision, there will be a scar, but could you talk through how the garments also support in reducing the appearance of scars?
Yes. So in the study that we conformed to, one of the main goals was to have a flat type of fabric.
Yes.
On the skin side of our fabric, it is extremely flat. It's knitted in a way that's a very flat surface.
Yes.
And the reason we do that is because we want to make sure that when each side of the epidermis starts to find each other in that incision that happens, and then there's a suture there. It's trying to find each other, it's trying to bundle that collagen back together, and it does sometimes cause a little bit of a raised appearance. Well, we don't want that. We want the scars to disappear, right? So a nice flat, gentle pressure is just going to make it look like a little hairline. You're never going to see it. So we really conform to those standards. We make sure that we look at every lot of fabric that's coming in. We even have an optical scanner that looks at the fabric and makes sure that, all the knit stitches are correct. So it's something that we take great pride in, and making sure that we're going to, do the best for the patient.
For sure. And I know we have an array of garments here, and I know there's even more available online and within doctors' offices. So are there any specific procedures where a garment would not be used, or what are the main procedures that garments are recommended for? So
typically you don't use a compression garment in rhinoplasty, but every other main procedure that's listed on the Aesthetic Plastic Surgeons Council website, we make a garment for, and we're constantly keeping up with all of the ASAPS and ISAPS data, which is International Society as well, to make sure if there's anything new happening. I'll give you an example if you'd like.
Yes, please.
Our FlexFit bras, when we found that plastic surgeons were starting to use fat, your own body fat,
Yes.
for your breast, we wanted to design and develop garments to make sure that, again, we are supporting that tissue transfer and we're not pressing on it. We won't want it to move. We don't want to in any way impact the doctor's work. We only want to help.
Right.
That's all we want to do.
Yeah.
So we designed and developed FlexFit, which flexes to where you are going to be from where you were,
Yes.
up to 1.5 cup sizes, which is typical for, you know, when you're getting an implant. They make sure that you're looking at your skin and making sure that it's, you know, able to handle certain cc's, and we do that. And the FlexFit technology has really been worldwide accepted, and it's really comfortable for the patient, and it doesn't impact the doctor's work.
I love that. Yeah, no, Marena, I mean, you guys are always at the forefront of just science and technology and advancement, so amazing. So as we talk about size and making sure that patients are in the right garment with the right compression to get the best results, how do you recommend that patients go about determining what garment is the right fit, and what resources does Marena have to support patients in those efforts?
Right, so we do have a customer service team and a customer service number. We have size guides and videos on our website, marena.com. But it's really important to look at your size guide and really measure yourself. Don't be critical of yourself. Your measurement is your measurement. And then what's going to happen is it's going to engage the compression appropriately. You really want to get as close to that size as possible. There's a slight range and variation with, you know, the 3 hook and eyes down the front, where you can make it a little tighter in areas that are a little looser, but you really want to feel like it's a gentle hug. And doing that, choosing the right garment, our customer service can help you walk it through. We have a lot of information on our website about it, and we do offer curvature type garments where you have maybe a smaller or pinched in waist and, you know, voluptuous hips and thighs, and that's really great. It's a great standard of beauty, so don't think that we only have one type of garment, one size fits all. We have a very broad size range. It's bigger than most of our competitors worldwide, and so we try to get everybody in a comfortable garment so that they really have the experience they need to heal properly.
Wonderful, wonderful. And then, you know, as you mentioned, don't feel bad if your measurement is not where you hope it is or where you hope it will be.
Right.
I know with surgery, a lot of people are like, oh my gosh, I'm inflamed, I'm swollen, so on and so forth. Marena's here to help all that swelling go down so you have the perfect aesthetic. Wonderful.
Absolutely, that's the goal.
Yes, and then I know, as you mentioned, you guys are a medical device.
Yes.
And are there any instances where insurance would cover any of these garments following surgery?
Yes, so our Caress line, which is our mastectomy line, all of the products in Caress particularly qualify what are called HCPCS codes, which are reimbursable at the DME, so Durable Medical Equipment Company would be able to process those for you.
Wonderful, wonderful. All right, and can you offer any just additional tips or advice to patients? I know the thought of surgery sometimes is a one-day thing, but I think Marena really, you know, focuses on the fact that, you know, surgery is a journey and recovery is a journey. So do you have any last-minute tips to share with the audience?
So this company was founded by a woman who really put the patient first.
Yes.
She, you know, eventually exited the company and sold it to another entity.
Yeah.
But we maintain the foundation of that principle. It's really important for us to design, develop, and offer a patient-first type of mentality. So that is why we go through the extra effort of making sure we have the third-party labs that are verifying everything that we do to make sure we have this very high-level quality management system, making sure we're tracking our garments. All of those things you want to look for as a patient, because you really do want your swelling to go down in a natural way so that there's no impact to your body. So at the end, you have exactly what the doctor ordered and exactly what you went to the doctor for.
Definitely.
So it's really important to really think about and listen to your clinician and follow their instructions and use a Marena garment.
And with Marena, we always want to remember that comfort is compliance, and so it's amazing that we have these garments that, you know, can help people on their surgical journey. So thank you so much for your time, Linda.
The pleasure is all mine.
Thank
I'm
you.
very happy to be here.
Thank you.
Thank you.
To learn more about post-surgical recovery and Marena garments, visit allthingsaesthetics.com. And don't forget to like, comment, follow, and subscribe.